Subscribe to our YouTube channel and press the bell icon to get the latest updates.
One of the topics we have been working on for quite some time now is science communication, a topic that is quite important in Switzerland for a couple of years now, and a topic that we have seen now really emerging in India over the last 2-3 years as well, has gained a lot of traction. And as part of these activities, we have been working since the beginning with the National Institute for Advanced Studies, who has a strong science communication focus. And this is why it is my particular pleasure today and honor to host this event together with Professor Shailesh Nayak, the director of NIAS. Thank you so much, sir, for joining us and for agreeing to moderate today's panel. I also, of course, would like to thank Professor Binoy, who is the face of NIAS science communication arm. In fact, we all have to credit Professor Binoy for coming up with the idea on studying the impact of COVID-19 on science communication. Based on that first Zoom conversation that we had together, we brought more parts together from Switzerland, the Swiss Academies for Arts and Sciences, and the Foundation Science and Cité, who's in charge of science communication in Switzerland, and from Boston, our colleagues from Swissnex. And then together with NIAS, we then launched a survey among science communicators across 3 countries, science journalists, scientists, and science communicators. And today, we're presenting those results to you, results which you can also read about on our interactive website, www.covidscicom.org. And again, you will find the link in the chat just shortly. On the website, we not only present the results, but we also give some personal insights from science communicators. We've done some interview podcasts. We provide some additional resources on articles, reports, blogs related to that topic. And of course, we also provide the data itself, which you can download and make your own analysis. In a few minutes, I will be presenting to you those results in a nutshell. But now I would like to give the floor to our guest of honor. There's an echo. Ambassador, can you just help? Sorry, thank you so much. He's a professor, Dr. Ralf Heckner is the ambassador of Switzerland to India and Bhutan. And later on, we will hear Professor Shailesh Nayak, director of NIAS. First, thank you, Ambassador Heckner, for taking the time to join us today. For our audience, a quick introduction. Ambassador Heckner is the ambassador to India since last September. He comes with over 2 decades of experience in the Foreign Service, previously as the Swiss ambassador to Kenya, with concurrent accreditation to Burundi, Rwanda, Somalia, and Uganda, and also he was the permanent representative to the UN office in Nairobi. Before that, he was heading the Crisis Management Center of the Department of Foreign Affairs, and he was also deputy head of the United Nations and other international organizations division. He had further postings in Washington and Italy, among others at the headquarters. Ambassador Heckner, thank you so much for joining us. And now the microphone and the screen is yours.
Thank you, Sebastien, for your kind introduction. I think it was the first time that I was too quick with unmuting myself. So we have been in this crisis for quite some time. It is a great pleasure to be with you, distinguished professors, doctors, scientists, ladies and gentlemen, and to join you on this online event on the impact of COVID-19 on science communication, and with that also talking about communication in a crisis. It is great to be with you, Professor Nayak, and Professor Binoy from the National Institute of Advanced Studies. It is always important for me as an ambassador to see our 2 countries connected in this respect. Like here, our research institutions working together. Let me touch upon 2 things shortly. One is communication in a crisis, and then why today's topic is important for our bilateral relations. As Sebastien said, I'm not a scientist, but I have some experience when it comes to crisis management. For 3 years, I dealt with kidnapping cases, with ships that were burning and buses that had accidents, and Swiss people were involved in this. So I have a certain understanding when it comes to crisis management and also crisis communication. And the very last point of each and every crisis management meeting was communication. What are we communicating after this meeting? What are we communicating internally? And what are we communicating externally? And what I learned was that a communication has to be clear and straightforward. And it needs to be facts-based. And I think when we talk about facts-based, then we are already talking also about science. So let me elaborate a little bit on that. The world of diplomacy is complex and the world of science is complex too. So we have that complexity that we share. And in those complexities that we have, there is a need to avoid misunderstandings between states. We have relations and the communication has to be in a way that misunderstandings can be avoided. So there, communication has to be clear. I think we also face the same challenge, diplomats and scientists, when it comes to propaganda, fake news, misinformation, but also that complex matters are being portrayed in a simplistic way and taken out of context. And there I think we have the same challenge to clarify facts, put things into context and perspective, and explain not only once, but several times the same thing all over again. And why is that so important? Clear and facts-based communication creates trust, because facts are linked to what people perceive as truth. And without trust, you cannot have relations between countries, you cannot have relations between societies, or relations between scientists, politics, and society. And communication in a crisis is so critical, because in a crisis, people are looking for guidance. They try to have something to hold on and that they can trust in. And especially in the COVID crisis, that is ongoing, long, very long crisis, keeping the trust of the people, keeping the communication is incredibly important. People are looking towards governments for guidance. They're looking to the scientific community for guidance based on facts and also explanations. They want to understand what is happening. So this bond between politicians, scientists, and society is essential to manage this crisis as good as possible, and not only in one country, but in each and every country. So this bond of trust between politicians, scientists, and society is key. And with that, what scientists say, you, the scientific community, your communication is of utmost importance to deal with this crisis successfully. And for this reason, I'm very happy to be part and parcel of today's event, which is important as a topic. Now, why is this event important for our bilateral relations? Well, this topic is part and parcel of our main pillar, one of our main pillars of our bilateral relations, and that is education, research, and innovation. And Sebastien already explained the mission of Swissnex, the science consulate in Bengaluru, to bring the science communities together. And for the Swiss government, India is one of the focus countries when it comes to our relations in science and technology worldwide. And today, this event creates exactly what the mission of Swissnex is. And that is to provide a platform for exchange on topics that are important to both of our communities. So today's event on the impact of COVID-19 and science communication will hopefully contribute to strengthen the communication of science in our respective countries, in India and in Switzerland. And I also do hope that this platform and event today will not only help us to deal with communication in this current COVID crisis, but also to deal with communication and then with solving the much bigger crisis that is looming on the horizon, and that is global warming. So the role of scientists has incredibly increased because of COVID, because of global warming. And I would like to conclude by saying that the Swiss government has put science as a diplomatic and foreign policy priority in its new foreign policy strategy 2020-2024. So here we are merging diplomacy and science. And for that reason, I was very happy when Sebastien invited me to be with you today. And with that, I would like to hand over to either our Master of Ceremony, Sebastien, or directly to Dr. Nayak. Thank you.
Thank you, Ambassador Heckner, and I will take over from here. Thanks so much for those very insightful and strong words. It is now my pleasure, as you introduce to our audience, Dr. Shailesh Nayak. He has a long list of accomplishments and appointments, so I'll shorten it quite a bit in the interest of time, but he's currently the Director of the National Institute of Advanced Studies and Distinguished Scientist in the Ministry of Earth Sciences. Dr. Shailesh was the Chair, Earth System Science Organization, ESSO, and Secretary to the Government of India for Ministry of Earth Sciences between 2008 and 15. As I mentioned, he had many other appointments, but he was also, for example, the Director of the Indian National Center for Ocean Information Services in Hyderabad. Dr. Nayak is a Fellow of the Indian Academy of Sciences in Bangalore and the National Academy of Sciences, India in Allahabad. Dr. Nayak has published over 150 papers in peer-reviewed journals and delivered about 190 invited talks in national and international fora. Dr. Shailesh, this will be your 191st talk. So thank you so much for your availability and for joining us today. The screen and microphone is now yours.
Thank you very much, Sebastien, for a very generous introduction. Very happy to be part of this very important event. And I'm very happy that Ambassador himself has been kind enough to participate, grace this occasion, and made very important comments about why the science communication is very critical. I think this joint work between Swissnex and NIAS is a very important part of overall goal which NIAS has been working to address some of the societal issues. And we have seen that any crisis like this pandemic has brought again the science and technology into the focus. And the normal people who are not concerned about generally by science we have been seeing talking about which vaccine is to be taken or not, or clinical trials or therapy and many other things. You know, people started developing a lot of interest in understanding that. Now, if you see this communication during such crisis, the three things are very important. One is the knowledge about any crisis or a pandemic. And as the pandemic started, last year, January, February, there was not sufficient knowledge about it. And people were not knowing, even the scientists themselves, not exactly sure that what the symptoms it would have, how long it will remain, what kind of drugs can be administered. Absolutely, there was no idea, a lot of trial and error. And this led to, because of absence of knowledge, the response, either from the government, is also quite different. In different countries, the government responded quite differently. And in India, if you see, there was a very strict lockdown came, and probably it was the idea that there is no infrastructure to handle this kind of a pandemic. So the lockdown was used to create that infrastructure, but it also led to a lot of miseries of migrations of labor and all. And essentially it is because the lack of knowledge which we had at that particular time. And the third aspect, because the scientists themselves were not very sure, the response of individual human beings also was a kind of a panic. You know, people were also scared and panicked, and there was no way how to convey that what was all about. But as time passed, the scientists, technologists, and many others developed sufficient knowledge and started communicating. The response of the government also improved. The vaccine development started. A lot of in India, especially, there was no infrastructure. There was only one lab when we started. Today, it is more than 1,500 labs. So in this process, today we are much better informed. And I think the whole system, of course, the media plays a very important role. But in India, which is not much talked about, but the major role played by the what we call as the ASHA workers and Anganwadi workers, who are work at the grassroots level. They tried to convince, like the very famous case of Dharavi slums, where these workers convinced them about the maintaining hygiene, the distance, the wearing masks. So I think we need to see how you can reach to the last person. And in that process, especially in India, the media alone is not always sufficient. We need people on the ground level whom the community trusts to get the information. The ambassador also mentioned about the trust. And I think this is very important. And I know that this survey is extremely useful. And I'm sure that it's not only benefit India and Switzerland, but I think we need to come together and come up with a recommendation which is global use. And I think because the problems are same everywhere, and I don't think this is the last pandemic which we are facing. Probably we may have faced much more, but I think we would be much better prepared. And I think the role of communication should be that all the aspects, the government, the academia, people, all should be well prepared to face any crisis. With these few words, I thank both Sebastien and Benoit to do extremely good survey, and we're looking forward to a brief results by Sebastien. Thank you.
Thank you so much, Professor Shailesh. It's a pleasure, again, honored to have you here. Thanks so much for supporting this project. So you mentioned the results. I will present them just in a few seconds, but first we will do a mini survey now with our audience here. And I'd like to ask my colleague to publish now the poll. So one question we'd like to ask everyone, including our panelists today, will the pandemic strengthen the place of science communication in our society, or will polarization and fake news weaken the credibility of scientists and science communicators? And so you have three options. You can be either an optimist and you think it will make it stronger. You can be skeptical and the negative impact of polarization and fake news will prevail, or you can be Swiss and say, well, let's not get excited here. The effects of the pandemic will be neutral in the long term. So up to you to now choose your choice here. Okay, so I hope you have voted. In Switzerland, as we know, we love to vote, so that's why we did this little poll. Now I'd like to present to you the results of our survey. Again, the survey has been done, or we have about 170 science communicators, science journalists, and scientists themselves who answered from three countries, the US, Switzerland, and India. As you can see, most answers came from India, and more or less equal. I think we had a little bit more science communicators themselves, so people who work in communication departments of universities, research institutions, etc. We had also quite a few science journalists being part of that, and researchers who communicate themselves. In fact, one of the first questions we asked our participants is like, how do you communicate? What is your favorite channel of communication? And obviously, social media was the most preferred channel of communication and most used. And here you see the data for Switzerland. So Twitter for science communicators being the main channel, with 80% of them using it on a very regular basis, if not daily, I believe. Then followed by LinkedIn, or by Facebook first, LinkedIn about the same, and then Instagram sort of catching up. Now, I think the interesting thing is, like, when you look at India, the data, so again, Twitter being the most favorite one with 88%, then Facebook actually being used quite a bit more than in Switzerland, 65%. But then what's really interesting, maybe not so surprising for you here, but is that WhatsApp is also one of the really interesting or really prominent channels of communication for science communicators. Instagram also a little bit catching up there. So one of the, I think, key sort of insights that this study brought was one of the trends that we have seen, of course, with COVID is also like the skyrocketing of the scientific output related to COVID. So there was actually an article in Nature. Around 4% of the world's research output in 2020 was devoted to the coronavirus. Depending on the different figures, there have been 100 and 200,000 publications on COVID, and really what has been also been observed is that the number of preprints has really increased dramatically. I think there are over 30,000 preprints on COVID, according to the Nature publication. And that, of course, also then is something that, for example, journalists will have to take into account when they write their articles. So, but the question that we ask is, like, especially also with the preprints, etc., is there an issue of quality control? And the answer that we got, especially from scientists, is yes. They think that there is an issue of quality control. I think over half of them have answered this, and as well the science communicators themselves. So this is something that we observed. It doesn't mean actually that the quality has really been any less, but this is at least the perception of researchers. Also, the time from the draft to being to the publication actually has been reduced rapidly, with the peer review taking only half that time than usual, at least in the beginning of the pandemic. Then the other question we ask is, like, to science communicators, like, who do you trust the most? And this, in some sense, is not really surprising, but in a way, a reconfirmation that science communicators, science journalists have a lot of trust in researchers and universities themselves, as well as in international authorities. And by that, I think most of them would be referring to WHO. So these seem to be the most credible sources of information for science communicators and journalists. I think the interesting thing here is, again, maybe not a huge surprise, but the journalists themselves, so science journalists, do not have that same credibility, even among their peers. So even journalists themselves would say that they wouldn't trust as much their colleagues than, of course, the trusted source of researchers and universities. The least trusted, again, influencers, I think nothing surprising. Life science companies also not being considered a very trustful source, and local public authorities. Again, that is across all three countries. The results were very much the same or very similar. One thing that we saw is, of course, one huge challenge that science communication journalists were facing was really the infodemic that came along with the pandemic. And so a lot of scientists had to spend time and energy on debunking sort of like fake news, making sure that people do get the right information. And even here in India, I think there was a group of scientists who came together to address this issue of fake news. And this is also reflected as one of the biggest challenges in reporting about the pandemic. It's misinformation, fake news, but also the politicization of scientific information. And I think that's also a bit of a debate we had last week in Switzerland, the politicization, instrumentalization of science and politics. And I think when we look at and if you compare the three countries, you can see actually that the misinformation is somewhat similar between India and Switzerland. So fake news as a challenge. In the US, even a little bit more. If you look at the politicization in Switzerland, it's not too bad, but 30% think that it's a challenge, a big challenge. Versus in India, it's about 50%. And again, I think in the US, as you can see, also in that heated environment that we saw last year, 80% again think that politicization is a big issue in terms of for science communication. So where do we go from here? I really would like to invite you to go and visit our website, COVID-SciComm. We have structures to support good science communication from our expert in the US. We heard that she's actually now censoring herself and has quit Twitter because she was trolled and is afraid of being drawn into that politicized environment. Some really interesting insights that I invite you to visit on our website. This is how it starts. So we have the analysis, we have stories, and as I said, the data that we share with you that you can download and do your own analysis. So again, a big thanks to our partners for this study, especially now here present NIAS, but also our Swiss partners, the Swiss Academies and Sciences and Cité. So with that now, I'm going to stop share the screen, and I'd like to now sort of ask our speakers of the panel to come on the virtual stage, and I'll keep the introduction short in the interest of time. But first, I would like to introduce and welcome Professor Gagandeep Kang. She's the professor of microbiology at the Wellcome Trust Center Laboratory at the Department of Gastrointestinal Sciences at the Christian Medical College, Vellore in India. She's also the first Indian woman to be elected as fellow of the Royal Society in 2019. Welcome so much. Thank you, Professor, for joining us. We also have Dr. Sandhya Koushika, professor at the Department of Biological Sciences at the Tata Institute of Fundamental Research in Mumbai. She has been very much engaged in community building activities around science communication, also on COVID-19. So thank you so much, Professor Koushika, for joining us today. We have also a journalist here, Ms. Sanjaya Ramesh, a senior editor at the Science, ThePrint India. She also has written regularly for leading publications like The Wire, the Hindustan Times, Mint, and the Planetary Society, among others. And she will be given the perspective from a journalist covering COVID-19. And last but not least, we also have a Swiss perspective in this panel with Professor Mike Scahfer, who's Professor of Science Communication at the Department of Communication and Media Research at the University of Zurich in Switzerland. Professor Mike Scahfer has been advising us on the project, but he also is the one who is doing the Science Barometer study in Switzerland. This is a regular study being done in Switzerland and other European countries on how society in Switzerland feels about science, scientists, how they perceive the value of science in society. And he actually also done a COVID-19 special, which again reflected a bit similar results as we had in terms of the trust in scientists. So with that now, I'd like to hand over to Professor Shailesh to moderate the panel.
Thank you very much, Sebastien, and I welcome very distinguished panel for the short discussion which we have on this. What I will do is I have one specific question for each panelist, and you can take about a couple of minutes to answer that. After that, there are some common questions for the entire panel, and then we may have some questions from our audience as well. So may I ask first question to Professor Gagandeep Kang. You have seen some of the results, and it was found that the most credible source of information is scientists or researchers, essentially. So in light of this lessons which we learned from the pandemic, is it worthwhile for a scientist to take more active role in respect to policy making and communicating science with society? Professor.
Thank you very much for that question. I think that isn't a question. Obviously, scientists must play a role in communicating with both the public at large, of which we are a part, as well as with policymakers. I think our levels of success vary with the audience and the approaches that we take to science communication. One of the things that particularly worries me is that we have a very vigorous and active debate in the English media. We have a lot of sources of information that are available to people, both local and global sources. But when it comes to the many languages that are spoken in our country, I think the quality of the information and the quantity of the information become very much more restricted. So if we are to think about scientists communicating and communicating clear, credible information from trusted sources, then one thing we have not done well is use the local print media as well as forms of social media to reach out to people who don't necessarily speak English.
I think I agree with you. Do you think the academies, science academies, can play a very active role in communicating in regional areas because they are everywhere present?
So the academies also have the same problem. All of our science communication by and large tends to happen in English. So unless we make a concerted effort to actually use different languages, it becomes more challenging. I think there are many programs that are being put out on TV and on channels that use a mixture of English and a local language, and sometimes that is successful. But I think it would be really good to see programs that are done purely in a regional language. And maybe Hindi has a hegemony in a sense in India. And I think for many parts of the country, it just doesn't work.
Thank you. Thank you, Professor Gagandeep. May I now go to Professor Sandhya Koushika? The question which I have is, many scientists and policymakers believe that pandemic has brought scientists and communicator communities much closer. What is your stand on this statement?
I wish I had, quite the confidence with which you stated it. I think it could be much better. I mean, it often seemed to me in the kind of outreach I was doing, and by no means is it extensive enough to make strong conclusions, but there is still a gap between the scientists and the communicator. And I think the gap comes in two places. One is the scientist has to effectively communicate what is known and how much you don't know and how well it is known. That automatically becomes an answer which has a lot of caveats. And I often find that communicators, especially if they are journalists, want a simplification which is very hard for the scientist to give. So I think that sort of is a process that you need to learn, and that's a process that needs to be established from the beginning. There are obviously some journalists and communicators who are exceptionally good at it, but especially what Gagandeep Kang said is something that we have seen ourselves in ISRC. We put out a lot of material in Indian languages. We put out these, put in a lot of effort in training people so that, we practice things in beforehand and have these call-ins where people could call in and ask questions about the pandemic. But we could not necessarily get the media interested in it so that you could take some of that and convert it into, say, print or other kinds of media, so you'd have much wider access to the information. So I think the gap exists. I don't think it's a negative thing. I think things are better probably than they have been in the past. I think there's recognition on both sides, but there's a long way to go. And there's a long way to go, especially in Indian languages. Some places it's easier. I mean, I think like, for instance, the Tamil Nadu Science Forum has deep roots in the community. So one has that that connection. But when you look at something you do in Gujarati, we're not able to get that. In fact, some of the things that we did in Hindi had the lowest amount of uptake in the beginning. So it was kind of surprising to me because Hindi is spoken in such and understood in such large parts of the country. So I think we still have some way to go. And I think that dialogue cannot be restricted to the pandemic. These have to be relationships, just as you need relationship between the person like an ASHA worker and that community. Likewise, you need this dialogue to take place, not just in the context of the pandemic, so that you can use it and there's a relationship where both sides understand what they're trying to get out from that piece of question that they ask you. Otherwise, they'll just call you and say, in 15 minutes, we want a 2-minute video where you debunk this. It's a rare scientist who works at that speed.
I think you made a very important point that how you can make it very simple. And you also made the use of ASHA workers and Anganwadi. Do you think it would be worthwhile to translate in the scientific output into a very simple languages, in different languages, Gagandeep has said? And we don't have such kind of a platform today, either in print or in social media. Do you think it would be necessary to have, and also for not for pandemic, but general science and technology output to go to people?
Absolutely. I mean, this is not, I mean, this needs to be done. But I would say, I would go one step further than that. That, yes, you need this translation, you need simple things to be put out. But you also need what I think would be where the grassroots people can speak to people who are, where they can bring their questions. So in COVID, it's easier because, it's all questions related to COVID. And, some scientists have been keeping up the literature. Some people like Professor Kang, who have been doing an admirable job in speaking in so many forums so that the rest of us can also get educated. But you need an ongoing, you can't have that restricted to COVID. There are going to be multiple different things which they're going to face. And we need people scientists who are willing to invest the time and mechanisms to link the two where people on the ground have access to the people who can explain things. And I think that would be really nice if it would come out from here. At least I see it as a gap. If you just do it issue-based, you'll have a patchwork quilt solution, which will maybe work here and there, but you would not have something which really addresses the depth and breadth of all of the communication needs with respect to science in India.
Thank you, Professor Sandhya. Now I go to Ms. Sanjaya Ramesh. As Sebastien has told that most of the studies which is published in Nature, that only 4% towards research output was devoted to coronavirus. It's quite large. And almost he also mentioned that 30,000 articles were not peer reviewed. So if you see this paper, the results are very sensational in some cases, but many times lacking scientific basis. So how did you balance the need to seek readers' attention and at the same time consider more balanced view of complex scientific method? How do you address both this?
Well, that's a really interesting question because especially with the COVID pandemic itself, if you're not a seasoned infectious disease reporter, chances are you found yourself in the situation where there are so many sensational findings coming out, but you don't know whether to write about them and how much of it is accurate. So I think this was a lesson that each of us learned as time passed by. One is that we first learned to sources, even with preprints, even though there are places like MedArchive and BioArchive, we narrow down the sources that we talk to and the voices that we trust, just like with the survey indicated, even journalists themselves, of course, we trust researchers above all other groups of people when it comes to the pandemic. So I identified certain voices that I trusted, and everything is great now. Everything is on Twitter. So you could get instant feedback about new findings and new papers that came out. And then you also sort of develop your own intuitive sense of understanding whether something is utterly completely nonsense or if something makes sense. There are some very easy filters you can apply. For example, if something sounds too fantastical to be true, then it likely is. So those are sort of instincts that I think kick in over a period of time, and the process would be the same as it is for regular citizens, where you identify the sources that you're able to trust and the voices you're able to trust, and see what comments they have to make on it. And I think also going hand in hand with this is that it is important when writing and reporting about these stories that you do not underestimate your audience. So I think it's always important to be honest with the audience, with the readers, and tell them exactly how much we know and how much we don't know. And I think people also do have their ability to understand how much to trust and what to believe in. And I think it's usually a mistake when we think that if we convey everything 100% to the audience, that it might scare the audience or something like that. I think it's a combination of all of those things help over time.
Yeah, I have just one small supplementary question. How difficult it was, say, last January and today to communicate about the COVID? What is the difference you can see during these two situations?
Well, things have changed a lot over the past year. For one, there are certainly facts that are well established now. I think in about Feb or March of last year, we were still talking about whether this is going to become a big pandemic. How does it spread? How much disinfection of surfaces do we need to do? And we were still analyzing all of those initial reactions. And things are, of course, much, much, much better. We understand how the virus spreads. We understand what kinds of drugs work and in what manner. We understand how so many other, all of these vaccines work. So I think the game has sort of changed and evolved a little bit to do more with logistical problems when it comes to reporting, as opposed to newer science itself. So I think that is one of the more remarkable differences that we can see in terms of the subject and the content that we get to write about. But also in general, it's sort of been very fascinating, because as not just a science journalist, but also regular citizens who are not deeply involved in academia, I think the past 1 year has given a good insight into how the scientific process itself works. So with that bit of additional context as well, I think writing has become much more nuanced nowadays, for sure.
Thank you, Sandhya. Now we'll have Professor Mike Scahfer. We had seen about the fake news one presentation on that. So did the deluge of information or a misinformation that happened during the pandemic influence the public trust in science, and what would be the best strategies to prevent such infodemic during such disasters in future? Professor Mike.
Thank you very much. And thank you also for having me. It's very interesting to hear about and learn about the situation in India and pandemic communication in India. I mean, in terms of trust in science, I think, yes, of course, the deluge of misinformation, the infodemic, as the WHO has called it, has influenced trust in science, but not to a degree and in a way that probably many people have feared. So if we actually look at the numbers that we have on trust in science, on trust in individual scientists, also to a degree in trust in authorities like the WHO, and we can look for India at the survey that Swissnex has done, for example, and we have data for a couple of other countries as well. indicating that what we rather see in a situation where many things have been uncertain early on, especially, and where people were looking for to make sense of the situation and seeking certainty and all that, most people actually turn towards the sources we all would probably like them to turn to, which was science and scientists and authorities that actually know what they're talking about. So we saw what political psychologists call a rally around the flag effect in many countries, which is a spike in trust in science that has normalized in many countries as well. We see this in Switzerland as well, but that is still above pre-pandemic levels. And that is good news. And it's also good news that many people turn to trustworthy media sources. So public service broadcasting in Switzerland, I don't know it for India, I have to say, but in Switzerland, public service broadcasting has seen a spike in audience numbers, for example. And that's all good news. That said, that doesn't mean, of course, that the infodemic and the amount of mis and disinformation that's around, and that's especially around in social media and in messengers, like WhatsApp is important in India, for example, which we don't see as well as researchers because it's more difficult for us to actually look into that. That still is a problem, and we can't avoid that easily also in the future, I have to say. So it is a situation that affects many people, and where many people want to speak out and seek certainty, and where also, of course, quite a few people seek to further a political agenda or gain a personal advantage of that. So there will be these offers, these deviant alternative interpretations. They will be disinformation will be out there, and it has always been out there. If you look at studies analyzing this historically during crisis situations, and the fact that we have social media where everybody can speak out now catalyzes that in a sense, of course. What we need is, I think, in the interview that Sebastien has mentioned, I tried to sketch this program of a more resilient society on many, and that's a big plan, a big program on many levels. Where on the macro level, we need to strengthen science communication. Professor Koushika has mentioned many aspects of that. We need to motivate scientists to speak out. We need to actually reward them and valorize it if they actually do it, for example. We need to train them also. We need them also to listen to what's actually needed in terms of science. It can't be a one-way monologue that we do if we speak as scientists. It has been a dialogue. We need science society, science policy interfaces, also interfaces that actually are structurally secure and that exist over time. Organizations that actually organize these exchanges. We have to talk, I'm speaking too long, I'm sorry, but we have to talk about science journalism, about the role of universities. And on the, just two more sentences on the individual level of individual people, we have to, train them to recognize certain things. We have to, there's research in psychology, very interesting, on how to inoculate people, how to vaccinate them, in a sense, against misinformation. And there's ways about how to do that. And we have to give them a sense of media and also scientific literacy that helps them navigate information that they encounter and actually figure out, well, what's trustworthy and what's not. And the COVID-19 pandemic and the fact that many people actually currently listen to science also provides positive opportunities to actually do that in the mid and long term, I think.
Thank you very much, Professor. This one small question again, what you have answered. The fake news or misinformation, we could see that it is at different level in different countries, varies quite big. Now, is the motive of those people who want to circulate such fake news is more or less same everyone, or there is a difference? Different people have different motives to circulate such news.
No, it differs from country to country. I mean, the example that many people look at for obvious reasons is the US, where not only do you have a very polarized political system and by extension or to some degree also society, but where also the system of communication in the country and the system of mediation in the country, the media system, for example, but also social media accounts and people or influencers that people listen to on social media is also polarized. And in that system, where previous science-related issues, like Ambassador Heckner has mentioned global warming, for example, or secondhand smoking, or other science-related issues, have already been treated along this kind of divide between two sides of the American society. I mean, that's a very fertile ground for a lot of dis and misinformation. And we see that also, whereas in other countries, you don't have this kind of fertile ground, thankfully. So the degree of dis and misinformation is lower.
Thank you very much, Professor. The next question I have for entire panel. The question is, how does social media change your work, either as a communicator or as a scientist? May I now first ask Professor Sandhya?
This has been remarkable. Actually, this is the only social media platform that I regularly use is Twitter, and it has been remarkable. I'm so grateful to the numerous scientists who go out there and explain things, break down preprints. I'm a neurobiologist. I'm not an infectious disease person or a vaccinologist. I'm sort of an accidental COVID-19 science communicator. And that has been critical. So people in India, Gagandeep, Kang, but also outside, Akiko Iwasaki, Eric Topol, there's a whole bunch of people. So, you would read the preprint, but, within 10, 12 hours, there will be a breakdown of that preprint. So I also felt this was really useful way for me. I don't do it as much now as I did it earlier. So where I would be going to spaces because I was aware of them. So it's the National Academy of Medicine in the US. There were these webinars which came from Johns Hopkins universities. There were in India, the National Cancer Grid had a series of seminars on COVID-19. And this is not necessarily something which a layperson will go and listen to. And I could take screenshots, I could write one-word summaries and put that out. And I thought this is a great way if people wanted to engage. And I think that's the positive aspect of social media. And in fact, I've had people who I don't know personally who have said that they follow me on Twitter only because of that. In fact, my Twitter following went up, I think, because I was doing this stuff. So I think it allows people to access information, which is usually restricted to smaller groups of people. Side by side, of course, there's a lot of misinformation and fake stuff which comes through Twitter, and I really appreciate the scientists who spend their time debunking it or countering it. And sometimes those things even come from people who are very credible sources. So, it's very difficult, and I really respect the people from doing that. On the balance, I would say social media has real positives. I don't have that much positive stuff to say for WhatsApp because it's somewhere which are these tiny little groups which are all with each other. There is no way for anybody to get in there and give a counterpoint of view. At least with other kinds of social media, you can do that. So that is both good and bad. But I would say the good outweighs the bad.
Professor Mike.
Social media, I believe I have to be an avid social media user because I'm researching science communication. So I feel like, okay, I have to know how Twitter and TikTok and also more recent social media actually work. So I'm on there and I do this a little bit. And like Professor Koushika said, it's twofold. On the one hand, I really benefit from it. I also benefit from it because people like me in my research field, science communication researchers, like me, they are very social media focused by now, and they are also on there, which means for me that in a research field that I'm working on that is very interdisciplinary, and that would normally mean that I have to have a look at 60 journals or something like that regularly to actually figure out what's coming out in my field, I can shortcut this via social media, because many of the people are on there and tell me on social media, look, there's something new I have done and we have this new project, all that. So I really like that. And on the other hand, of course, I see the mis and disinformation, and sometimes my research topics have been, for example, climate change communication was something I'm still working on and have been working on for quite some time. And I don't always feel brave enough to venture into these discussions, but sometimes I do, and that's not always fun, of course. And I can see that, but I feel it's sometimes necessary to do that, especially maybe this as two sentences, especially if I feel like I am speaking to a, let's say, a climate change skeptic in front of an audience, where actually other people who are not skeptics themselves necessarily can see us, so that they actually see, well, there's other positions out there as well, and these other positions kind of make sense too, and or maybe I won't venture down the wrong path. Yeah.
Ms. Sanjaya Ramesh.
Yes, so I think my experiences also echo what both Dr. Sandhya and Professor Mike said. I think it is a double-edged sword in the sense I've received a lot of benefit from social media. I do use Twitter as well primarily, and I think I'm immensely grateful for the kind of people that it has allowed me to connect with and the sheer scope of help it has offered to my work. But at the same time, like Professor Mike was saying, that there's also rampant disinformation and misinformation going about. And that too, as a female journalist, often I don't even feel safe saying and opining some things that I would otherwise. So I think it's a mixture of both. And I've always been a vocal proponent of using social media professionally and to use it well. Once you figure out how that particular tool works, I think it's each platform can be tremendously useful to what you want to get out of it.
Thank you. Professor Gagandeep.
So social media makes me feel tremendously guilty. I used to use Facebook, came off that 3 years ago. Recently been doing a little bit with Twitter, but it's always like there is so much to do and there's so little time to do it in. And you know that when you put something out there, it reaches an audience, it can be amplified, but it takes a lot of time. And, as Sandhya said, really grateful to the people who do a fair bit more of this than I do. I wish I had more time and could do more. What Sanjaya Ramesh said about feeling unsafe, I think one of the advantages of being older and not really caring is that you can get out there and say what you want to say and hang the consequences. So try to do that a little bit.
Thank you very much. The last question to our panelists is, with 1 year into this pandemic, what are your personal lessons learned? We'll start with Sanjaya Ramesh.
What are my personal lessons learned, is it? That's a tough one. Well, I think speaking as a journalist, I would say what I was saying earlier is that sort of giving our audience and readers the benefit of doubt as to whether they really understand something or not. This was something that I think I learned sort of very early on in the pandemics, that to not underestimate the audience and the people who are reading the content that you put out, and sort of trust their judgment as well. And I want to say, keeping in line with the last question discussed, another really good learning is making really effective use of social media. And Twitter especially, I've gone and created n number of lists this time on Twitter, and people have been following, and I hope people have found it useful as well. So leveraging social media and sort of these kind of social tools and enabling them to work professionally for you, I think that was something that many of us learned during the pandemic this time.
Thank you. Professor Mike, may I have your views?
Yes, sure. In education science, there's this concept of the teachable moment. A moment when you can, when by sometimes external circumstances, you are forced to stand still for a moment and think about things. And that's a concept I like, but that's also what I felt the pandemic did, in a sense, to me personally, to think about a couple of things, including, like, I don't know, flying to conferences or traveling to a lot of different meetings, to places where we actually could have met in the format that I would rather have liked to come to Bangalore, of course. But I mean, you can do many things in this format as well. And that's, for me personally, was one of the takeaways from that. And as I hinted upon earlier, I think more broadly, I think we are also, it's a teachable moment, or it can be a teachable moment for us as societies for how to improve science communication, because the importance of science communication and also the challenges that we have are clear to many people, including decision makers right now. So if we want to build capacities and infrastructures for the long term, now's a good time to do it.
Thank you. Thank you. Professor Gagandeep?
So I think for me, what I learned was that I want to do more. So seeing the kinds of issues that we've had in India, I think there are lots of gaps that really need addressing. So if I have a platform now, I'd like to use that to be able to do more for particularly primary healthcare in India.
Thank you. Thank you very much. Professor Sandhya?
I think the biggest thing which I knew going in instinctively, but I sort of solidified that, is people who come and seek out information. They are, sometimes they even have ideas which are maybe not in line with current scientific thinking, but it's really important to respect and engage with them in a respectful manner. I think you have much better ability to get them to see your point of view if you develop that kind of communication. And you don't have to agree with them, but I think often if you treat them with respect, it really helps the conversation along, and you're more open-minded to what you have to say. I think I was very struck by that. I sort of thought that would be the case, but it really turned out to be, I didn't expect that to be as important as it has turned out to be. The other thing which I realized, and here again, I echo what Dr. Kang said, it's very important that we build structures early on. I can see several gaps. One of the things is really develop enough citizenry, develop close interactions with scientific institutions and the local populace, which is not advertising the science that you do, but really to sort of supplement and develop critical thinking, develop those kinds of tools which at a time of crisis people can use well. Right, because they would have exposure to these ways of thinking, and then they're not fumbling around the dark. I'm not thinking about somebody who maybe can access the Atlantic and eat Ed Yong, or look at Sandy Grains on Twitter. I'm not looking at such people. I'm thinking about the person who drives the taxi and the person who runs the kirana shop locally, right? Because they have pressures on them. So I think we have to find a way to do that. I don't know how effectively we can do it, because I have some understanding of how science communication is done from institutional settings, and it's not targeting these people at all. But in a pandemic, those are the people who need to have that information. Not just someone who can, have access to many sources of information, and they just it's just very different, and there's lots to be done.
Thank you very much. We can have a couple of questions from the audience. Question is from Bharat Kera. The question is, WHO reversed that advisory on masks in early phases of pandemic. There have been other similar reversals by CDC. Did this impact trust these organizations? May I request Sandhya to answer? Sandhya Koushika. Professor Sandhya.
Sorry, it was a bit patchy. Can you just...
it was WHO reversed that advisory on masks and the early phase of pandemic. So,
I think the main thing which I would say is, I think one of the things that was said early on with respect to masks really applied to surgical masks. But the other thing is people should recognize that this is how science goes. You will have an advisory which is true today, and then as either more information comes in or people have a time to look at older information and reassess, it is going to change. And I think this is again a gap between the scientific community and the general public at large, is that this changing place is something which you should expect and is what is going to happen. But people sort of expect that you would have everything figured out, this is it, and then, that's not the way science works. I mean, I can't comment on, all the discussions which WHO or the CDC might have had in this regard. But I think pretty early on in India, there was a strong push to have masks as early as April of last year. And I felt that was very well done, and I think at least as a country, we have sort of stood by that very well.
From Manoj Varghese, I would request Sanjaya Ramesh to answer this question. It says that Dr. Sandhya rightly said that the journalists want a simple answer from scientists, which is very complicated task at the scientist end. How can we bridge that gap?
Well, get more science journalists. I think that's a simple answer. So yes, I understand both parties here when we're talking about non-science journalists who often do attempt to do science, which of course will be the case if I try and cover some deep political or military issues as well, that I do not understand that the journalist does need the scientist to explain it to them in the right context, because your job as a journalist is to gain a proper understanding and then in turn to understand it, to explain it to other people so that they understand it. So I think the only way to actually bridge a gap here, one is, of course, in general, before going to interviews and things like that, is for the journalists to do their homework. And the other is, I mean, I'm sorry, it's a simplistic answer, but it is to get more science journalists who are invested in the scientific method, who understand it, who are able to gather enough subject matter knowledge on their own through their own work and have the ability to understand it as well. I think eventually in the longer term, that'll be the way to go about it. And I think for immediate situations, it's the journalist just has to do their homework and ask more pointed questions.
Thank you very much, and I very wholeheartedly thank all the panelists for very, very active interaction. And now I hand over back to Sebastien to take the program ahead.
Thanks so much, Professor, and thank you to all the panelists for your very precious insights. We're a little bit late, so I will keep it very short. If this was a physical event, you would now enjoy some flowers and Swiss chocolate. But sorry, I'm sending some virtual Swiss chocolate. But I hope the next time we can meet in person, and then we'll catch that up. Big thanks to you. I think we can now quickly show actually the results of the mini poll we did in the beginning of this event before I will hand over to Professor Binoy for his final word. If we could just show the, so very nice to see that we have a lot of optimists in our audience. I think 68% think that the crisis will make science communication only stronger. You're actually more optimistic than Swiss people. Swiss people only 50%. So thanks so much, Solomon. I think we can close it. I think one parallel that I saw as well, maybe what Sanjaya Ramesh said at the end, more science journalists, more resources for science journalists, and there was exact same sort of ask in Switzerland. So we see that there are some very nice similarities, and I hope really that the pandemic will then lead to more investment into science communication and science journalism. So with that, I would like to hand over to Professor Binoy for a short final word. And thanks so much for everyone for joining, especially Ambassador Heckner and Professor Shailesh. And Binoy, the floor or the screen is yours. We can't hear you, Binoy. We cannot hear you. And now it's good.
Yeah. So thank you, Sebastien, for the nice words about the program. Now we are moving to the final phase of today's program. Like, you know, every good program also has to face the end. So it was nice discussing a lot of interesting topics connected to communicating science in the crisis. And it was a great learning opportunity for all of us to learn directly from the luminaries, from the field of science, communication, and policy making. So I will be quickly expressing the word of thanks. First of all, I thank Ambassador Dr. Ralf Heckner for accepting our invitation and finding time in his busy schedule to attend the event and give the introductory remarks. Thank you very much, sir, for your support. Next, Professor Shailesh Nayak, Director of NIAS, who is an inspiration for us. Whenever we contacted him with this plan, he was very happy, and till date, we are getting his constant support. Thank you, sir, for your support as well as moderating the event. Now the panelists. So Professor Gagandeep, Kang, Dr. Koushika, Dr. Sanjaya Ramesh, Professor Mike Scahfer, all these busy people found their time to enrich our experience so on behalf of organizers, partner institutions, and participants, I thank all of them for finding time to share their experience with us. Thank you very much. Now a brief thanks for the team COVID-SciComm. We will start with Sebastien. So this is saying, if you have a good leader, trust that you won the war before it starts. And we were lucky to have the best with us. So thank you, Sebastien, for enthusiasm, your efforts, which made this survey and event possible. The core team members, Jonas, Anju, Lionel, are also thanked for their support. Another team member requires special thanks is Vidya Kamaresh. Thank you, Vidya, for the effort and the time you spent on this event and survey, which made this event a grand success. So on behalf of the team COVID-SciComm, I thank Tobias for helping us with the data analysis. And our collaborators, Claudia Appenhenser from Swiss Academy of Science, Philip Buchart from Science City, and Kiana Stampley, again from Science City. So the supports given by SwissnexIndia, Swissnex Boston, National Institute of Advanced Studies, Bangalore, Swiss Academies of Arts and Science, and Science City, and SwissIT are also remembered with gratitude. Last but not least, the participant of today's event. You know, in this deluge of online events, thank you very much for finding time to attend the event and asking very interesting questions. Thank you. Thank you very much.
Thank you.
Yeah.
Thank you.
Thank you so much. Have a very good evening.